Hi, my name is Brandon, and today I'll be talking to you about epilepsy. So you may be asking yourself, what exactly is epilepsy? Well, epilepsy is a disease of the brain that is characterized by recurrent seizures. It is defined as having two or more unprovoked seizures, and epilepsy is also considered a spectrum disorder. This means that it is a disorder that exists within a wide spectrum of other disorders. Epilepsy ranges in its severities. There are many different types of seizures as well as many different causes of seizures, and they have various impacts on individuals and their families. Epilepsy is the fourth most common neurological disorder in the United States. It affects people of all ages, but it mostly occurs in children and older adults. 2.2 million people in the United States have epilepsy, and more than 65 million people worldwide have epilepsy. About half of all epilepsy patients suffer from either a cognitive or a psychiatric condition. In this picture here to the right, you see that the number of people that had active epilepsy in 2015 was at an all-time high in the United States. Someone who has active epilepsy either had recent seizures or they are taking epilepsy medicine. This was 470,000 children and 3 million adults, which made up about 1.2% of the population, or was 3.4 million people. In this picture here, you see active epilepsy prevalence in the United States by looking at each of the individual states. In this picture, the lighter the color, the lower the number of active epilepsy cases, whereas the darker the color, the higher the number of active epilepsy cases. The darkest color states are California, Texas, Florida, Illinois, Michigan, Ohio, Pennsylvania, New York, and North Carolina. These states had estimated numbers between 92,700 to 427,700 of active epilepsy cases. And again, Pennsylvania is in that range. So what are seizures? Seizures are brief episodes of involuntary movements that may involve a part of the body, which would be considered a partial seizure, or it can involve the entire body, which would be a generalized seizure. Sometimes seizures are accompanied by a loss of consciousness and control of bowel or bladder functions. Seizures are caused by excessive electrical discharge in a group of brain cells, and seizures can last up to as long as a few minutes. Seizures are classified into two different groups. You have generalized seizures, which affect both sides of the brain, and these are absent seizures, which cause rapid blinking or consist of a few seconds of staring into space, or they are grand mal seizures, which can make someone cry out, lose consciousness, fall to the ground, have muscle jerks, or spasms. The other classification group is focal seizures, which are located in one area of the brain. These are simple seizures which affect a small part of the brain, complex seizures which can make a person confused or dazed. They are unable to respond to you for up to a few minutes. And then you have secondary generalized seizures, which begin in one part of the brain and then spread to both sides of the brain. In this picture here, you see that 60% of epileptic seizures are focal seizures, whereas 30% of people that have epilepsy experience generalized seizures, and the remaining 20% of people that have epilepsy experience non-epileptic seizures. So what causes epilepsy? Well, epilepsy can be caused by a number of things, such as brain damage from prenatal or perinatal causes. This could be due to a loss of oxygen or trauma during birth, or having low birth weight. Congenital abnormalities or genetic conditions with associated brain malformations, a severe head injury, a stroke that restricts the amount of oxygen to the brain, an infection of the brain, such as meningitis or encephalitis, genetics, and a defect in the genes is one of the largest causes of epilepsy, and more than 150 genes have been linked to epilepsy, or something like a brain tumor. Temporary symptoms occur such as loss of awareness or consciousness. You have disturbances of movement, sensation, which include your vision, hearing, and taste, and you also have disturbances in your mood as well as other cognitive functions. So, epilepsy is diagnosed in a number of different ways, like a neurological examination, an EEG, which is a test that detects abnormalities in electrical activity of the brain. Electrodes are placed onto the scalp to detect and record patterns of electrical activity and to check for any abnormalities. An MRI, which uses powerful magnets to construct pictures of the body, as well as a PET, which evaluates the energy activity of the brain. This measures how intensely different parts of the brain use up glucose, oxygen, or other substances, so it depends on what they're looking for. Epilepsy has different effects on the exercise response. These are fragile bones, problems with balance and coordination, slow reaction times, and people that have epilepsy may sometimes be overweight due to the medications that they are taking. People with epilepsy tend to have higher rates of psychological conditions like anxiety and depression. Studies have shown that those with epilepsy who exercise have significantly lower levels of depression. One of the most common triggers for epilepsy is stress, and as we know, exercise can help stress levels. Physical activity in sports can also help prevent and counteract the side effects of some anti-epileptic medication, such as weight gain or increased fragility of bones. In this picture, you see that 1/3 of people with epilepsy experience depression and anxiety, which is the most common comorbidity of this disease. Another statistic that won't matter until later on when we get to my exercise prescription is that people with epilepsy are 15 to 19 times more likely to drown than the rest of the population. So, seizures that happen during or after exercise can be due to triggers such as extreme fatigue, lack of sleep, dehydration, hyperthermia, and hypoglycemia. Epilepsy cannot be cured, but seizures can be controlled. Up to 70% of people that have epilepsy can become seizure-free with the appropriate use of anti-seizure medicine. However, medicine does not work for everyone, and if it doesn't work for you, the patient may be recommended to have surgery or do other therapies. These include the ketogenic diet, which is high in fats and low in carbs, or vagus nerve stimulation. Medicines to help prevent seizures are called anti-epileptics. And in this picture here, you see that current treatments are vagus nerve stimulation, surgery, anti-epileptic drugs, and diet. Side effects of anti-epileptics are fatigue, dizziness, skin rash, problems with memory, coordination, or speech. Sometimes there's weight gain, increased fragility of bones, and some of these side effects can also affect sporting performance, like fatigue and tiredness, blurred vision, problems with concentration, problems with balance and coordination, poor motivation and energy, and slower reaction times. For my case study, I had Kyle, who is a 17-year-old male that has epilepsy. He is currently on medication for his seizures, so his seizures are considered to be controlled. He has a BMI of 20 kilograms per meter squared, a BP of 118 over 70 millimeters of mercury. His total cholesterol is 180 milligrams per deciliter. His HDL is 60 milligrams per deciliter. His LDL is 110 milligrams per deciliter. His fasting blood glucose is 80 milligrams per deciliter. He is not a smoker. He also does not have a family history of CVD. He lives a sedentary lifestyle, however. He gets tired easily by walking up and down the stairs. Kyle's goals are that he wishes to improve his cardiorespiratory fitness. Like any other teenager, he wants to be able to play with his friends. He also wants to improve his muscular strength and endurance, as well as improve his flexibility and balance. So, some of Kyle's risk factors are listed here. He only really has one risk factor, which is that he lives a sedentary lifestyle. The rest are not risk factors, and these are that he's less than 45 years old, his blood pressure is less than 130 over 80, he's not a smoker, he has no family history of cardiovascular disease, his BMI is less than 30, his LDL is less than 130, his HDL is 60, which is a positive risk factor, his total cholesterol is less than 200, and his fasting blood glucose is also less than 100. So he only really has one risk factor, and then he has a positive risk factor, which is that his HDL is 60. Some special considerations that I feel are important for people with epilepsy are that they do not work out by themselves. This is very important in case they do have a seizure during their workout. So they should be monitored or work out with a friend or family member, which is considered like a buddy system. They should not be prescribed swimming because, going back to my statistic from earlier, people with epilepsy are 15 to 19 times more likely to drown than the rest of the population. So I would not prescribe swimming for that reason. I would also not have him ride a bike. This is due to balance and coordination issues, as well as the possibility that he could have a seizure. If he were to want to ride a bike, I would have him do a stationary bike ergometer. I would also have him start by using his body weight as well as machines due to the fact that there are balance and coordination issues. And in the case that he were to have a seizure episode while working out, he wouldn't have that extra weight that could possibly cause an injury. And if he's on a machine, he's already most likely sitting down, which is safer. I would also make sure that he gets proper sleep, he's hydrated, he's in proper workout clothes, takes frequent breaks, and that he has ate something prior to exercising. This is important because triggers are extreme fatigue, loss of sleep, dehydration, hyperthermia, and hypoglycemia. And we do not want these people having seizures while they are working out. For exercise testing, I would have him do the YMCA submax cycle ergometer test. To test his muscular strength, I would have him do a 1RM bench press test. For flexibility, I would have him do the sit and reach test. And for balance, I would have him do the Romberg test. For exercise prescription, for cardiovascular endurance, I would have him do either walking, jogging, or do a stationary bike at 60% of his heart rate max for 5 days a week, 30 minutes a day, which would total 150 minutes each week. His sessions may need to be split into 3 different sessions of 10 minutes each day because of the fact that he is currently sedentary, but we would eventually go up to 60 minutes a day. For resistance training, I would have him do free weights, machines, and calisthenics at 50% of his 1RM for 3 days a week and 2 sets of 10 reps. For flexibility, I would have him do static stretches for all the major muscle groups. I would tell him to stretch to the point of mild tension or of slight discomfort. This would be done 3 times a week, and each stretch would be held for 15 seconds, and this would be done 2 times each stretch. And for balance, he could do something as simple as going and taking yoga classes or just practicing yoga on his own 2 days a week for 30 minutes a day. In conclusion, epilepsy is a brain condition that is characterized by recurrent seizures. This is not a rare disease, so it is very important to be familiar with epilepsy because you could have a client that does have epilepsy. It is not curable, but it can be manageable with medications. It is also extremely important that these people participate in regular physical activity in order to improve their quality of life because, as we know, exercise is medicine. These are my works cited. Thank you for listening.